Hello. Did you know that common parasites in our pets can sometimes take a wrong turn and end up in humans? This is known as larva migrans. There are two main types we need to know: cutaneous larva migrans, or CLM, and visceral larva migrans, or VLM. CLM is caused by animal hookworms like Ancylostoma brasiliensis. These larvae live in the soil and are looking for a dog or cat, but they can accidentally burrow into human skin. VLM is different. It's caused by roundworms like Cutaneous. In this case, the infective stage is an egg found in contaminated soil. When these eggs are accidentally swallowed, the larvae hatch inside us. Because humans aren't their natural hosts, these larvae get lost and begin a journey through our bodies that they can't complete. So, how do these parasites find us? It all starts with pet waste. When infected dogs or cats leave droppings in sand or soil, thousands of eggs and larvae are released. For cutaneous larva migrans, the biggest risk factor is walking barefoot. Think of tropical beaches or damp garden soil. The larvae sense the warmth of your skin and active penetrate, meaning they crawl right through your pores. For visceral larva migrans, the risk is mostly fecal-oral. This is common in children who play in public parks or sandboxes and then put their hands in their mouths. Since the eggs are microscopic and hardy, they can survive in the environment for years. This makes handwashing and pet hygiene our first line of defense.
What happens once they are inside? Let's distinguish between the two. In CLM, the larvae are trapped in your skin. They lack the enzymes to go deeper, so they wander aimlessly just under the surface. This creates the classic creeping eruption, a red, itchy, snake-like track that moves a few millimeters every day. It's very itchy, but usually stays on the surface. VLM is more serious because the larvae can enter your bloodstream. They travel to internal organs like the liver, lungs, or even the brain. Instead of a rash, symptoms include fever, coughing, or an enlarged liver. Because the body tries to fight them off, it creates inflammation called eosinophilic granulomas. In short, CLM is a skin problem. VLM is an internal organ problem. If you suspect you have larva migrans, don't panic. Diagnosis for CLM is simple. A doctor can usually tell just by looking at the skin track. For VLM, doctors use blood tests, like an ELISA, to look for specific antibodies. Management is very effective. For both conditions, doctors typically prescribe antiparasitic medications like albendazole or ivermectin. These kill the larvae quickly. For CLM, you might also use a topical cream to stop the itching. Prevention is the best cure. 1. Always wear shoes on the beach or in the garden. 2. Deworm your pets regularly. 3. Wash your hands after playing outdoors. By staying informed, we can keep ourselves and our furry friends safe. Thanks for watching.